Happy Friday. Wonderful weather outside. So obviously, a lot of you have been wondering what's going on with the monkeypox, what's the deal there? And since especially US have declared monkeypox emergency yesterday, I think it's appropriate for me to spend 5 minutes talking about the disease and answer some of the questions. So if you have questions about monkeypox, don't hesitate. Shoot them in a box. You know how this goes. Put the questions in there. If you absolutely have to ask it, wait until I'm done with my talking, and then we can have a little Q&A before Nancy goes. So, of course, monkeypox is kind of similar to smallpox. It's a lot milder disease. It is a zoonotic disease. Spelling is not my forte, but I will try. Zoonotic, I think it's like that. So it means that it originates from animals. It's actually kind of presumed similarly with COVID. So the COVID presumably originated with from animal too. And it's monkeys. And the disease is sort of similar to smallpox. So you got the same kind of bad rush and a lot of systemic symptoms: fever, chills, muscle pains, lymphadenopathy, so swelling of the lymph nodes. It is misconception to think that disease is only sexually transmitted. We just so happen to have primarily currently in US that disease is transmitted mostly at the moment among men who have sex with men, but that's just for the immediate future. I'm sure that will change very soon. It is actually quite more contagious than just through sexual contact. It's contagious through any close contact, even through droplets, but it needs to be very close. So it's not as, of course, even close contagious as COVID. Otherwise, we would have a true second horrible pandemic on our hands. In the base case scenarios, the mortality is somewhere around 5%. The numbers I've seen are somewhere from 3 to 8%. It's actually not very clear because that's a reported mortality from prior smaller pandemics in Africa primarily. But it's not really clear if that's going to be the translatable numbers to US. We're going to have to see. But even if it is, it's still quite significant. And the burden of illness is pretty severe. It's not a couple of day COVID-like illness. People can be sick for several weeks. There is an acute phase with the rash and with all those other symptoms I mentioned. And then there's a gradual improvement over several weeks, but the symptoms can last up to 4 weeks. And the incubation period is a lot longer. It's upwards of 2 weeks. Couple of really critical points. So and I had to look this up, if you were born in US and you were born probably before 1970, you don't need to worry about anything because you've gotten the smallpox vaccine, which is a lifelong protection and is still protecting you. So Salome, that's answering your question. So you don't need to worry about this. You're completely protected. So this is an unusual case where, in contrast to COVID, actually younger people are really the ones at risk. So those who've been born probably past 1970s, and they don't have this kind of, I don't know if you can see this. See that scar over there? So if you don't have that scar on either shoulder, unless you, for some reason, didn't develop the scar, but most people have it. Those who have, of course, know. That's the sign of a smallpox vaccine. I, of course, had it in Russia, and in Russia, they stopped doing it in the 80s, so I got locked out so that I got that, and I don't need to worry about that. So MMR is not a smallpox, and you just need to know your age. So if you are older than in US, it would be, what did I just say, 1970, so that would be 52, then you don't need to worry about it. You most likely have the vaccine. Now, what currently is done by the US, so there is a specialized vaccine which Biden's administration is trying to rev up. Luckily, the vaccine was being part of a stockpile. So this is a disease that BARDA, it's a government organization that protects against biological warfare and also epidemics, have been tracking actually for decades. So they have two things. They have a stockpile of vaccines, and then they have stockpiles of the medication, so-called, one second, let me look it up. I had to, it's called TPOXX. And it's an antiviral drug that's reserved for severe cases. And currently there's over almost 2 million doses available. And the vaccine is behind because they've given the vaccine quickly and they need whatever was in stockpile, but they have to rev up the production, which takes a little bit of time. But honestly, I don't really think that it's going to become a major national problem. I think it'll be a very concerning problem, but it's not going to escape into something horrendous because a large percent of population is vaccinated. So the pool of people who can get infected is much smaller. So I'm gonna stop here because I think that's more than enough. I'm already at 2:12, and should put the question. I'll give you guys a couple of minutes to put the questions in the chat. Otherwise, we'll hand it off to, as Janet lovely said, Dr. Nancy, our own Dr. Nancy, who is the part of the AIM Health Institute. I don't see any questions. I guess nobody cares about monkeypox. That's a good thing. I think actually it is a good thing. I think we should still care more about COVID than monkeypox, especially since most of us here on the call are probably vaccinated anyway. Actually, with Nancy, you being a good exception, probably not vaccinated because you're much younger.
Right.
So should the people be getting the vaccine? Great question. So of course, if you had the vaccine, no. It's a lifelong vaccine. You don't have to recheck your immunity. It's a very stable immunity. It's very unlikely that you've lost that immunity from that vaccine. So Benita, you're fine. Now, what if, say, for Nancy, should she get vaccinated? So that's actually interestingly not such an easy question. I think I'm going to wait for the CDC guidelines. Right now, they say that people at high risk constitute men who have sex with men, and anybody who lives in a household with somebody who has monkeypox. So, but physicians, for example, the younger physicians like Nancy, should they be vaccinated? I have not seen a specific guideline on that, but I'm presuming that as they rev up the vaccine availability, Nancy, you'll be one of the first lines to get it. And I would recommend people getting it. Even if the monkeypox is not as bad as smallpox, it's a horrendous disease and it'll put you out of work for a month. You'll be highly contagious and you'll have to be isolated. It's a nightmarish situation. And, you're going to survive most likely. You heard statistics, but it's not something that you want to deal with. The scarring from the vaccine is a minor issue. The scarring from the monkeypox is a significant issue. Personally, I don't remember when the last time I saw somebody walking around being a survival of a smallpox, but you can just Google the question. You can just Google pictures of people surviving smallpox. Monkeypox survival is not going to look like that. They're going to look a lot better, but it's still going to look like you're going to have scars for the rest of your life, and many. And so it's also, there's going to be consequences short-term and long-term, even you completely recover from a metabolic perspective. Right, so if you're in your 40s and you didn't get the smallpox vaccine, you should seriously consider it as soon as you're going to be named in that category of people who is eligible. But I honestly, I wouldn't really rush because I think the risk currently is going to be really small. But I would keep a radar close on this. Oh, this happened again. Noodles got on a windowsill and turned off my light. Dogs will be dogs. Sorry, guys. It's right there. It's that black box that no. It's from this light. Oh, he pulled it out of here. Okay. All right. Well, that's my signal that I'm passing on to Nancy. If you guys have questions, save them. I'll address them after I restore my lightning for the camera.
Thank you so much, Misha and Janet. It's so nice to be here again, to see everyone and be on this wonderful platform. Just as a quick introduction, I'm Dr. Nancy Aboulmouna. Janet gave a great introduction. I just want to add that I currently work as a contract physician with the CDC. I'm a contractor physician with the CDC in the Division of Global Migration and Quarantine. So I am currently at Dulles, Virginia at the airport, and where we handle cases of infectious disease entering the country, and just kind of triaging those particular circumstances. So I also teach at American University in the Department of Health Studies. I absolutely love that. I'm on the board of directors for AIM Health Institute, which is a co-sponsor of this platform, and the owner of Cedars Natural Health. So I will pass my contact information along to Janet. So if anybody has any questions after the presentation, I might need to log off after I speak, and I'm going to shorten my presentation just a tad bit. But if you have any questions, you can reach out to me at any time. So today I'm going to be talking about stress management. Just a quick medical disclaimer. This presentation is only for educational purposes and informational purposes, and it should not be taken for medical advice. And if you have any questions, just consult your physician or functional medicine doctor. You can reach out to me at any time as well. So I'm going to be talking about stress management because clinically I see a lot of the effects of stress on patients. We all deal with stress to different degrees on a daily basis. So what is stress? We talk about it all the time. We always, we tend to mention we're stressed out at work, deadlines, kids, finances, you name it. Right now, maybe inflation, monkeypox, COVID. So we're always bombarded with stimulus, and we are trying to navigate among the stress that we encounter. So stress begins with an external stimulus. And what that does is it disturbs our internal physiologic response. So when we get stressed, we have signaling that occurs between our nervous system and our endocrine system. Our endocrine system refers to our hormones, so our hormonal system. So we have two types of stress. One is acute stress and one's chronic. So acute stress helps us to regulate our body during moments of immediate response. So, for example, we encounter stimulus and our pupils will dilate, our heart rate will increase, blood flows to our extremities, and we're able to then react immediately. And of course, our physiologic response in this way to stress can be super helpful. However, when we are chronically stressed, our response can become quite dysregulated from a physiologic standpoint. And ultimately, this will lead to health disruptions. And these health disruptions can span across many systems of our bodies. So we can disrupt our circadian rhythm, which is involved with our sleep. It can cause systemic inflammation or meta-inflammation, which is a low-grade constant form of inflammation, which has been shown to cause disease and chronic disease. It can disrupt our immune system, our microbiome, our GI tract, and also our mental well-being. So especially clinically, I see the most common things I see as a result of chronic stress are GI symptoms and anxiety and depression, so our mental health. So let's talk more about what happens physiologically when we get stressed. So we have two main responses. One, for the first one, begins in the brain. So we've got the hypothalamus in our brain and the anterior pituitary gland. So we have signals that are released between the hypothalamus gland, the anterior pituitary gland, and then from the brain, a signal is released to our adrenal gland. And our adrenal gland is a small gland that's located just on top of our kidneys, and it produces hormones like cortisol and DHEA. Cortisol is known as our stress hormone, so it is released in times of stress. And I'm going to talk about DHEA further on in this talk. So cortisol, what does cortisol do? It ultimately regulates our blood glucose levels by stimulating production of glucose in the liver, and that's a process called gluconeogenesis. It also regulates the immune system, and it regulates our metabolism of carbohydrates, fats, and proteins. So the second physiologic response, other than what I just talked about, which is the brain communicating to the adrenal gland, that whole process that I just talked about, I'm going to refer to as the HPA axis. So it's the hypothalamus, pituitary gland, and our adrenal gland. So that's the HPA axis. The second response that we get from
Nancy,
stress.
could you move a little closer to the mic?
Sure. Sorry. Did everyone catch what I said? I hope. Is this better?
I think it's a little better, but I think it's not just the issue of a computer. I think it's just the room this way is very large room, I think, right?
Yeah, you're in one of those
Oh.
rooms that echoes.
Yeah, the room gives an echo, and I think it's just, it is what it is. So.
But thank you for
We've got a
getting
negative
closer to
air
the mic.
pressure system. Sorry about that. Okay, so I'll try to talk a little bit louder. So the second physiologic response that we get when we're stressed involves our sympathetic nervous system. So the sympathetic nervous system is really our fight or flight nervous system. And it helps the body respond quickly to a stressful circumstance. So a response from our sympathetic nervous system will look something like dilated pupils, increased heart rate, increased breathing rate, etc. So practically speaking, we're all subject to multiple stressors at any given time. So how do we know if stress is affecting our health, right? That's ultimately what we want to know, because we all have a different capacity and ability to handle stress. So we can have physical symptoms that can everyone hear me?
Yeah, it's okay.
Yeah, you can hear. Okay. So we can have physical symptoms that can indicate that we're stressed. And then we have ways of checking chronic stress through lab testing. So what I mentioned today doesn't obviously encompass everything that we can look at, but it's a good starting point, especially when we talk about the labs. But first, let's talk about some of the physical effects of chronic stress that you may notice in a particularly stressful span of time in your life. The first that is most often seen is excessive fatigue. And this is also related to not having really a normal sleep schedule. So sleep can be affected when you're chronically stressed. And the reason why sleep can be affected is because when cortisol is produced in excess from our adrenal gland in response to stress, it can spike at times of the day or night when it's inappropriate. And we'll talk more about that later. So another effect of being stressed is feeling overwhelmed from trivial problems that maybe you would have before never really been stressed at. So you might have friends or family that start to notice. You may not notice it yourself, but friends or family may say, "Hey, you know, you sound overwhelmed," when before this used to not be really an issue for you. Relying on coffee or other caffeine beverages to make it through the day, even upon rising in the morning. A boost of energy after 6 p.m. So our cortisol levels are supposed to decline as we approach evening time while our melatonin increases. And that starts to make us feel sleepy. But in people who have a dysregulation due to chronic stress can have spikes in cortisol in the evening when it's really supposed to be going down, and that can make you feel more awake than you should, or prevent you from getting a good night's sleep or falling asleep. One of the major causes, like I said, I've seen clinically or results of stress is anxiety and depression, GI symptoms, food cravings, especially sugar or salty foods, a decreased sex drive, decreased appetite. And another thing that I do tend to see is an imbalanced immune system and people who tend to have chronic viral infections especially. So in addition to those symptoms that you may notice, there's some lab testing that can be done to assess whether or not chronic stress is taking a toll on your body or present. One of the markers that we look at is cortisol. So cortisol can be checked through, it can be salivary or it can be hair. And you know, chronic stress impairs our circadian rhythm, which affects our sleep, but also affects our HPA axis in response to stress. And it can cause excessive evening levels of cortisol and reduced morning levels of cortisol. So again, cortisol is our stress hormone. So we want cortisol to increase, to rise as we wake up in the morning and allow us to have energy and the ability to handle the day. But we want cortisol to drop as evening sets in. So cortisol is supposed to drop in the evening while melatonin goes up. So checking cortisol can be significant at different times of the day to see when it's spiking and to check whether or not that is appropriate given the time of day. The other markers that we look at is DHEA, and this is checked through a blood test. It's also an adrenal hormone. I had mentioned that earlier, that the adrenal cortex releases the DHEA and cortisol. And DHEA is important because it actually opposes cortisol, the action of cortisol. So it kind of keeps cortisol in check so that cortisol is not getting too excessive at times that it shouldn't be. So with acute stress, we see that the DHEA production is increased. But interestingly, when we're talking about chronic stress, we see that DHEA, that we see lower levels of DHEA coupled with high levels of cortisol. So looking at that relationship is important in detecting a chronic stress type of picture. Two other markers that we look at are salivary amylase, which is an enzyme that's secreted in our mouth and in the pancreas for the digestion of starch. And in times of stress, salivary amylase increases as well. And the last marker that I'm going to talk about today is salivary immunoglobulin A, or IgA. So that's an antibody that's found in our mucosal membranes. So we have mucosal membranes in our mouth, our respiratory tract, and in our GI tract. And it's been shown to increase with acute stress, but it has been shown to be depleted in times of chronic stress. So taking a look at these markers together can really paint a picture of what's happening in a patient and in the time of stress. Okay, so in the interest of time, I'm going to skip over a few things so let's talk about nutrition and lifestyle practices that can help with chronic stress. So we know that nutritional deficiencies, so not getting enough nutrients, exposure to toxicities, and lifestyle habits can all affect us physiologically, and it can more specifically affect our adrenal glands and our response to stress. So the first and foremost, the first thing that I always tell patients that is so important is mind-body practices, focusing on deep breathing, slowing down the mind, because that can actually help our physiologic response to stress. So I look forward to Nina Paul guiding us through a mind-body practice later, but that is really essential because you can use mind-body practices at any point during the day or any time in your life when going through a stressful circumstance, and that can help mitigate a bit of the stress and physiologic response. So there is hormone therapy there are three main hormones that we look at when we're trying to address chronic stress. One is DHEA, which I had just mentioned, which is one of the hormones that keeps cortisol in check. It's secreted by the adrenal gland. And the balance between DHEA and cortisol is actually pretty well maintained when we're young, but it really starts to fade as we age. DHEA actually starts to decline quite sharply. So supplementation with DHEA, of course, it needs to be checked and you need to speak with a physician, but supplementation with DHEA has really been shown to help keep cortisol in check. Other great benefits of DHEA, a lot of studies have shown the negative impact of cortisol on the brain for dementia and Alzheimer's disease, and DHEA has been helpful in countering that. Also, DHEA has shown to reduce the incidence of coronary artery disease and reduce metabolic syndromes that are usually characterized by abdominal obesity or insulin resistance, and show up in people who have glucose intolerance or diabetes. The second hormone that's used in therapy with chronic stress is melatonin. It has an
Oops, I think we lost Nancy there.
Yeah, I think we did.
All right, I'm gonna fill the space because CJ asked a really good question here about the testing. Hold on a second. Seva, can you guys quiet because I'm talking to everybody, sorry. And so you really can't routinely check for those tests. They're almost never covered. Genova supposedly covers, Medicare does cover Genova, but you have to have a provider who knows how to order it, and most of the providers have no idea what that is. Those of you who are my patients, many of you have enjoyed this test through the Medicare. Unfortunately, there's some shifts and we don't know if that's going to maintain because the Genova has been changing some of their policies, how they do the tests. They're not super expensive tests, but they're not cheap. You're looking at a few $100s. There's a morning cortisol test and there's something called a STIM test. So the STIM test is done only in cases of adrenal insufficiency. So this is a diagnostic test for severe illness. This is not what we're describing. The morning serum cortisol can have some value in a certain circumstances, but unfortunately, I don't think it's sensitive enough to be used as a screening tool. And perfectly, Nancy's back. Nancy, back to you. There was a good question that I took care of in the chat about the tests for the stress response, and I kind of went over that. The actual better tests are not labs. They're actually things like HeartMath, which is a biofeedback system, or there's some other more complex physical exam tests for stress. So I don't know, Nancy, if you were planning on discussing those, but those would be probably the right things. But again, you guys are gonna have a really hard time finding a physician, unless it's Nancy or I, to screen for something like this during any visits. So just to keep that in mind.
Thanks, Misha. I'm sorry I got disconnected there. Thank you for answering that question. Yes, there's a whole host of tests, and that's why I mentioned what I'm going to talk about today won't include everything, but there certainly are other tests, and I skipped over the heart variability testing too, which is quite important as well, just in the interest of time. But again, if anybody has questions, Janet will have my contact information, and you can reach out to me anytime. I'd be happy to answer any of those questions. I'm not sure where I got cut off, but I was talking about the 3 hormone therapy approaches for chronic stress. So hopefully we caught all of that. But I'm going to quickly move on to nutritional aspects and herbal aspects to addressing chronic stress. So we always hear eat more fruits and vegetables, but that is extremely important when we're talking about stress, and your overall well-being is so much better when you do increase your fruits and vegetables. So there was a study that showed in young adults who had increased their fruit and vegetable intake by 2 servings per day for 2 weeks, and it resulted in enhanced psychological well-being, vitality, and motivation, increased motivation. So a really good diet that focuses on more fruits and vegetables is the Mediterranean style diet. It also has a lot of olive oil, which is healthy fats, the whole grains, fish and nuts, including fruits and vegetables. So, and that definitely helps with better regulation of our HPA axis. A second thing that's really helpful in mitigating chronic stress or responding to chronic stress is eating breakfast regularly. So it can help to build a stress resilience. And compared to breakfast skipping, the habitual breakfast eating can be associated with lower levels of perceived stress, better cognitive function, and fewer job-related injuries, as shown in studies with nurses. A couple things you do want to minimize in your diet would be caffeine and alcohol. So caffeine, it's tough because if you're chronically stressed and you're feeling fatigued, caffeine will seem really attractive. It's going to help pick you up in the morning, but its effects can really aggravate symptoms such as anxiety and poor sleep, which comes along with chronic stress. Alcohol is also used for some people as a relaxant during times of stress, but excessive intake can raise cortisol levels in the long term, and it can lead to even more dysregulation with the HPA axis and signaling and cortisol levels. So those definitely need to be consumed in moderation. And then with caffeine, there's also cutoff times that I discuss with a lot of patients, depending on how quickly they can metabolize caffeine. They may need to have a set time to cut off their caffeine consumption. Some people, it's as early as 9 a.m. Some people can consume caffeine as late as 12 noon. How much more time do I have, Janet?
Actually, we've gone over.
And I did my best to take care of the questions. So if anybody else have a last, maybe let's just do one question to Nancy.
And again, any questions we don't get to, or I can give more detail later, Janet will pass my contact information along.
Right. Benita, that's exactly the test that I was talking about. That's called Adrenal Stress Index. So that's the 4 to 6 point test throughout the day. It's usually saliva. On a rare occasions, it can be done as urine, but we don't recommend it. It's always saliva. It's not diagnostic for diseases, but it's very good to address how your adrenal gland responds to the current stressors in your life.
So what I didn't get to go over are some nutritionals and herbals that are very, very important and key in helping with chronic stress. So maybe I can put together a quick worksheet that Janet can send around. Hand it over to Nina.
Okay, can everybody hear me okay? Okay, great. Thank you so much for that wonderful, well, it wasn't PowerPoint, but that presentation was very helpful to me personally as well. So today we're going to practice a few mindfulness meditations, and we're going to focus on cultivating the mind and body state of equanimity in the meditation. So equanimity is a state of even-mindedness and balance. It is the ability to be with things as they are, the ups and downs of life, while remaining steady and calm. And it is not an elusive goal to become more equanimous or to have more equanimity. It can be cultivated through mindfulness practice. And we're all going through challenging circumstances right now in one way or another. So I thought the equanimity meditation would be a good practice to focus on. So to get started, go ahead and get into a posture that works for you. You could be sitting. If you feel like you want to stand up, by all means, go ahead and stand up. Perhaps you feel like lying down. Whatever posture, pose, feels like it's what you need. This practice, mindfulness, can be practiced in any position. And then when you're ready, we're going to take a few deep, calming breaths, and I'll be guiding you to have long, slow exhalations, which connects to what Doctor was talking about, that we can actually calm down our fight-flight response with these long, slow exhalations. So let's take a deep breath in through the nose. Long, slow out breath out through the mouth. And again, breathing in through the nose and out through the mouth. Let it go. And another deep breath in. Long, slow, deep breath out. And let's do one more full deep breath in. Long, slow out breath. Let it go. Returning to the natural rhythm of your own breathing when you're ready. And get a sense of yourself arriving here into this moment from where you were. Get a sense of your body standing or sitting or lying down here, breathing. You can feel your feet against the floor. You can feel and sense into your legs. Perhaps your legs are making contact with the chair. And relax the hands, perhaps feeling your hands on your lap. Relax the belly, soften the belly as best you can, and bring your shoulders down away from your ears. You can have your eyes open or closed, whatever's most comfortable for you. And to bring more ease into the body, we can relax the jaw, perhaps opening and closing the mouth a few times to release the jaw. Softening the eyes and the eyelids as best you can. And relaxing and letting go in the forehead. Filling the entirety of the face with awareness, just letting it be and letting it go. And sensing into the entire body now, standing here or sitting here, breathing moment to moment. Just feeling the breath as it comes in and as it goes out, moment to moment. Perhaps feeling the rise and fall of the belly or the chest on each in and out breath. Not trying to change the breath in any way or achieve anything. Just letting it be. And anytime you notice your mind has wandered off to distractions, nothing has gone wrong. That's perfectly natural tendency of the mind. Just noting that. And then bringing attention back to the breath, back to the body. Over and over again. It's the essence of the practice. And now from the breath, taking attention to the sounds that you're hearing. The sounds coming and going moment to moment. There could be sounds inside and outside of the rooms. Maybe loud sounds or soft sounds or no sounds at all. Just noticing sounds moment to moment as you're breathing. You can ask yourself silently, what am I hearing right now? Feeling the body, breathing as you're noticing sounds moment by moment. And now we'll move into Equanimity Meditation. Yeah, in the meditation, we're going to be exploring words and phrases, that feeling and quality of equanimity. And just reminding you, there's no right way or wrong way to feel as we will be exploring these words and phrases. Just opening up to this quality of equanimity, inviting it in as best you can. And so now call to mind a time when you felt some equanimity during a challenge you encountered. It could be a very tiny thing or a big thing where you were able to take a pause and stay non-reactive. Bringing the memory of this time to your mind's eye, this time where you felt balanced in spite of the circumstances. Maybe you even surprised yourself. Bringing it to life in your mind's eye. Where were you and what did you see and hear and feel during that time where you experienced equanimity during a challenge that you had? If nothing is coming to mind, imagine a mountain and its qualities of being steady and solid amidst the storms and changing seasons of life. Feel into yourself and notice, what does this sense of strength and solidity, expansiveness and equanimity feel like? Things were as they were, and you handled them with equanimity. How are your mind and body feeling right now as you're imagining that time or the image of the mountain? Allowing yourself to open up and take in this feeling of equanimity that may be arising. And if that quality of equanimity is not arising, that is no matter. Just opening up to the possibility of feeling equanimity. Feeling sturdy and strong and steady like a mountain. We'll continue to cultivate equanimity by focusing on the following phrases And I'll say them one at a time, and you can repeat them after me to invite in even more equanimity. No matter how much I wish things to be otherwise, things are as they are. This is how things are right now. This is how things are right now. May I accept things as they are. Even though I wish some of these things were otherwise and were not happening. I accept myself just as I am. I am as I am. May I be kind to myself and accept myself just as I am. And may I accept you just as you are. With great care, I accept how things are for you. Noticing how your mind and body feel right now. Is there any sense of openness and balance and peacefulness arising, allowing yourself to expand into that and take that in? And if equanimity is not arising, that is okay as well. Bringing a kind awareness to whatever else may be arising. This is how things are right now. I accept things just as they are. If you'd like, you can put your hands on the heart center of your chest. Bring more stability and steadiness to the body and the mind. I accept myself just as I am. I am as I am. May I be kind to myself and accept myself just as I am. And may I accept you just as you are. With great care, I accept how things are for you. Bringing attention now to the breath. Getting a felt sense of the body, standing or sitting here, breathing moment to moment. Noticing how the body feels. What is arising for you now? Meeting whatever it is with kindness and acceptance. Continuing to incline the mind towards equanimity. Whenever you're ready, you can gently transition out from this meditation. Take a deep breath in, deep breath out. Gently open the eyes or lift your gaze, perhaps stretching. Welcome back. So I'll be sending some information on equanimity, different meditations to try, different talks about the philosophy of equanimity, and inviting you to dig deeper, some reflection questions on what equanimity means to you. When did you experience equanimity? And how does your mindfulness or any other mind-body practice strengthen this quality of mind? So it's been great to be here in this community. Thank you. Thank you for joining me. Take good care.
Thank you, Nina, so much. Everybody have a wonderful weekend. Nancy had to leave us a little bit earlier, but we appreciate her input. And Janet, if you're still here, I think you are. What's our next Friday's guests? Who are their guests?
Give me a sec.
Good time.
It is going to be Megan Baer, who is an assistant professor at Johns Hopkins, and the wonderful Catherine Miller
Wonderful.
from Four Directions Wellness.
We're looking forward to see them. CJ, thanks a lot for putting that article in so everybody can copy paste that. If you still want to take a look, that provides more specifics about cross protection from the smallpox vaccine. Stay
And
well.
I'll include that in the news, in the email.
Very good.
Bye, everyone.
Bye.
Thank you.